Congratulations, MAGA. Your vote for Trump is the reason why senior citizens will be kicked out of their nursing homes. Before you flood my comment section screaming fake news, I'm going to provide some verifiable facts. Google's free. You can go look at the bill. 60% of nursing home residents rely on Medicaid to cover their care. That is a fact. And Trump's new tax plan, it cuts the provider tax by 41%. This slashes how much support states receive from the government for nursing homes. That's a 41% funding cut. That is a fact. The American Healthcare Association says that 1 in 4 nursing homes could shut down and half of their staff will be eliminated. That's a fact. So where do these senior citizens go? Some might have family to take them in, but for others, this is the end of the road. There's no place for them to go. This is what your vote for Trump is doing. It's pushing vulnerable seniors out of care and onto the streets. And that is a fact. This isn't America first. This is our elderly last. If you voted for Trump, you made this happen. I hate to say it. This is on you.
So, trending on social media right now, there is a woman asking why her father is being kicked out of his nursing home by September, and he's on Medicaid. So let's talk about why this is happening. Across the country, nursing homes are cutting ties with Medicaid residents, not because they want to, but because they can't afford to keep them. Medicaid pays some of the lowest reimbursement rates in the entire healthcare system. And in many states, those rates haven't kept up with inflation, staffing costs, or increased medical complexity. So nursing homes are losing money on every Medicaid patient that they currently care for. This crisis didn't start overnight. Under the Trump administration, federal policy pushed for Medicaid cuts, block grants, and privatization, what he likes to call the Big Beautiful Bill. That agenda sought to limit federal Medicaid funding and shift the financial burden to states. So now in 2025, we are living with the consequences. The COVID era protections that paused redeterminations are long gone. Medicaid unwinding has dropped over 20 million people. And with fewer residents covered and payments still too low, nursing homes are making hard financial choices. So some are shutting down entire wings. Others are refusing new Medicaid admissions. And yes, some are discharging long-term residents. So if you're asking why your father is being kicked out, the answer is because the system is being defunded on purpose. When you vote for politicians who promise to shrink entitlements, this is the real world result. Elderly people getting eviction notices. This isn't just bureaucracy, it's policy. And it's hurting families like yours right now.
600 nursing homes are funded by Medicaid. Yes, you heard me. 600 nursing homes. So the grandma that has dementia or the grandfather that has stage 5 cancer will be on the streets because they are all in jeopardy of being closed due to funding for Medicaid. Congratulations. You got what you wanted. A bigger homelessness problem.
Find the Dot family. Today we are looking at a serious issue. Our gap in Medicaid funding and nursing home policy are forcing some of our senior citizens out of care facilities, sadly, onto the streets. This is a challenge affecting families across USA, and it raises important questions about how we care for our elders. Please relax, have your coffee. I'll be back for more documentary.
You comfortable with those significant cuts to Medicaid? Look, I came from a family where it was a broken home that I was adopted by my grandparents. My grandparents were extremely dependent upon Medicare, Medicaid, Social Security, and when my grandfather had quadruple bypass, we were dependent upon disability to try and get by. We were that lower to middle class family. My grandfather was a welder, my grandmother was a stay-at-home mom and cosmetologist. I know the importance of Medicare and Medicaid. No, I do not want to see any impacts of that.
My dad lives in a nursing home, and by now I'm sure you've seen the video circulating about the woman who's really concerned because her dad is getting kicked out of his nursing home due to Medicare. And this is just the anticipatory changes that the big, beautiful bill is putting into place. What people don't understand is a lot of nursing homes are actually owned by these big corporations, right? So the big corporations, your local branch isn't that, but like they are owned like by private equity, things like that. Like I know the one that my dad lives in is like that. And so the rules kind of come from on top. So it sounds like some of these nursing homes are figuring, well, we're not going to get reimbursed from Medicare in the future. So we're going to just start evicting people who, you know, pay that way because we don't want to suffer the losses. And instead we'll try to fill those spots with people who pay out of pocket. Now, in my case, like my dad, we actually pay out of pocket, or I should say he pays out of pocket for his nursing home care. But what is it going to do when I guarantee you like 70-80% of the people who are at my dad's facility are in some type of Medicare reimbursement, especially if they're in like very long-term care situations. Like that is super common. I don't think people understand that. And so what's going to happen when these facilities can't fill the apartments because there's not enough people who can afford? I mean, to give you an idea, it's over $4,000 a month, guys. $4,000. I mean, think about like that. That's like almost triple my mortgage. Okay. It's crazy. And in my case, like what would happen if I was in this situation? Because I'm thinking about that. Like what's going to happen if like my dad's facility, for example, shuts because there's not going to be beds anywhere for these people to go. So the burden is going to be on the families. And like in my case, I don't have anywhere to put this man. And I don't live in a handicap accessible home. And there is no housing in my area. So I can't just like pick up and move. And I have a mortgage from 2011. Like I can't just move. Like that's not really an option. So like I don't know what I would be doing if I was in that same situation, and I am really worried. And if you're thinking, well, I'm so lucky, I don't have anyone in nursing care, I'm not going to be impacted. Let me just tell you that this is just the one little arm of the ripple effect that this is all going to have, right? What's going to happen when hospitals aren't getting reimbursed for things? What's going to happen when your doctors are not getting reimbursed? They're going to go private practice. I'm telling you, this whole healthcare system is like on a house of cards. Like it's all going to come crumbling down, and it's going to come crumbling down fast, unfortunately. So if you are worried about this, if you have loved ones that are going to be impacted, or you know you're going to be directly impacted by this, please know you're not in this alone. Please give me a follow, give me a comment, because I want to engage with people that are going through this same thing, because it is not easy and we need to come up with strategies together. And sometimes it's nice to just have somebody to vent to. So anyway, I'm here for you guys.
Breaking news. If the Republican budget passes for Donald Trump, it's going to result in almost 600 nursing homes to close. 579 is the number that's been estimated by a study by Brown University medical officials. And if you have anyone that is in a nursing home, nursing facility, if these roughly 600 nursing homes close, who is going to care for them? Who is going to pay for it? You know, again, the Republicans are not telling you this. There is a reason by Tom Tillis, and he came out and was quite outspoken about it. A senator, Republican from North Carolina, voted no, and also Senator Rand Paul of Kentucky voted no. They both know this is detrimental to the health of the country. And why are the Republicans that voted yes for it? They're either concerned about Trump, and they're more interested in their millionaire and billionaire friends getting a tax cut. Do you have, again, family members that are in a nursing home? 600 nursing homes are on the chopping block if this goes through. They won't receive funding. Who is going to care for your elderly family members that are in nursing homes at this point? This is not about work requirements and saving money and making people work. Can they work? Can your family members that are in nursing homes work? Putting in a work requirement for them? Most of the people that are on this are elderly. I mean, get your facts straight. You know, Mike Johnson, Donald Trump, they don't tell you any of the truth. And y'all, MAGA, don't bother to look. Well, if you've got family members that are in a nursing home, you're going to not be happy if this thing passes and they all are going to have to come and live with you, or who's going to take care of them. Think about it. Do your homework. Call your senator, call your congressman, area 202-224-3121. And two specific ones that really need to be called are Susan Collins of Maine, because she kind of says she's a no vote, but she voted yes on the procedural vote. Her direct phone is area code 202-224-2523. That's 202-224-2523. And also Senator Lisa Murkowski of Alaska. She's indicated she was going to vote no, but she voted yes on the procedural vote to proceed. Her direct dial is 202-224-6665. Let them know what you think. And it's your family. It's money that you all pay into Medicaid to take care of them. And what are you going to do if they can't stay in their nursing home that they're in? Love you for my Democrats, my MAGAs, my crazies, my cuckoos, my burned out light bulbs. Let me know what you think.
Live in my shoes. How would you like to live off $70 a month?
As we close today's conversation, it is important to remember that behind every policy and budget, decisions are real people, our parents, grandparents, neighbors, and loved ones who deserve dignity, safety, and compassion in their late years. When nursing homes struggle to keep residents because of Medicaid limitation, families often face heartbreaking choices. Where will their loved ones go? How can they continue receiving proper care? For families affected, the first step is to seek out all available support systems, local community resources, non-profit organizations, state health departments often have programs designed to provide assistance beyond Medicaid. Families should also explore in-home care options, respite programs, and advocacy groups that can help them navigate this complex system. It may feel overwhelmed, but no family should walk this journey alone. To policymakers, this is a call for reflection and action. Strengthen medical support for long-term care and ensure adequate funding for nursing home. It is not just a policy decision, it is a moral responsibility. Where seniors are left without proper care, society as a whole bear the burden. Invest in elder care means investing in compassion, stability, and respect for those who pave the way for us. And to all of us as a citizen, is it important to keep this story alive? Talk about them in your community. Support organization works to protect seniors and encourage constructive dialogue that lead to real solutions. We want to also recognize this creator of this video we stitched into this commentary for bringing such an important issue out. Thanks for helping us see and share the reality many families are facing. Find the Dot family. I would love to hear your thoughts. What do you think government, community, and even family can do better to support our elders? Please share your opinion in the comment section below. Don't forget to like, share this video to spread awareness, and subscribe for more thoughtful discussion on issues that actually matter. Thanks.